Hi, my name's Brian Wojak, and today we're going to talk about weight, sleep, and diabetes. Obesity is a disease process that worsens things like sleep apnea. So worsens the quality of your sleep. Patients that have obesity are more likely to develop diabetes, hypertension, fatty liver disease, strokes, cardiovascular disease, hyperlipidemia. So obesity is related to these things because, one, it complicates these other disease processes and often creates them. Sleep is related to both obesity and glycemia because there's data to suggest so. Sleep disruption and arousals have an effect on glycemia, right? So there's at least some data to suggest that, and maybe some preliminary data to say there's some effect on beta cells and stuff like that. So the sleep disruption and the arousals might have an effect on that, and more importantly, there's pretty good data to say that it has an effect on obesity. So sleep disruption of any flavor has been shown to increase a hormone called ghrelin, decrease a hormone called leptin, and make people hungrier. So people that are more sleep deprived tend to gain weight for those physiologic reasons, at least as far as we understand them. Diabetes is kind of the outcome of these two processes. So it is complicated by both obesity and sleep. Myself and I think most of my colleagues in the field really focus on comprehensive care. When we treat weight, a significant weight loss can both treat and in some cases even perhaps eliminate sleep apnea, so obstructive sleep apnea. It is a treatment for apnea. If I see someone for weight management, the goal is to say, how do we treat your weight? Looking at all these different factors, and then say, how do we treat all these different factors? And then look at the complications of weight. So, do you have a sleep disorder that is caused by weight? And as we said, this is kind of a vicious cycle. So do you have a sleep disorder that's affected? And then I refer and evaluate the sleep issue, and then we look at the other problems. Diabetes. Is there some sort of high cholesterol, et cetera, and see if those complicating factors are present. And then with weight loss, see if we need to reduce treatment, because often as we treat the primary problem for many of these disorders, we need less stuff. We need less therapy. We might need less sleep therapy too. So it's a persistent reevaluation of whether we're appropriately treating a patient and their needs. Weight and sleep are one. First, very interrelated. They affect each other in profound and important ways. And then two, that weight is a disease process that must be treated as such. And then three would probably be that we always have to be on the lookout for the complicating factors of weight, and as we treat weight, kind of always try and reduce our therapy or adjust our therapy to the requirements of our patients. So, but I think the big one is really that weight is a disease, and that's something that I think when I see patients in my clinic, they're almost always shocked to hear, because everyone has always heard that weight is your fault. It is because you don't have enough willpower and eat less and exercise more, and that is simply not true, and that's data driven. So I would say that the most important thing that we can tell anyone is that weight is a disease and it needs to be treated and medically with a comprehensive plan.